Okay, let's get started. We're in the skeletal system 3. Joints, also called articulations, is where the bone connects to the bone. So we can put them into different categories based on their function or based on their movement. If based on the movement, the joints can be divided into 3 different categories: synarthrosis, amphiarthrosis, and diarthrosis. And some joints, they use the fibrous, they call the fibrous joint. They use the dense connective tissues to put the bones together. For example, these 2 bones, the radius and ulnar, this one's ulnar, this one's longer. And between the radius and ulnar, they put the dense connective tissue to form the joint. Another one called the suture. So suture, we talk about this in the bone part. So between the skull and the skull, and they glue together, called the suture, completely immovable. But it's very, very strong. So in a joint, the concept is you can have flexibility, you can have mobility, flexibility, but you cannot have both. So like the suture is the one with very strong stability, but it has zero flexibility. And then we're going to focus about the joints. They have a maximum flexibility, which has very little stability. And there's another kind of joint called syndesmosis, connected by ligaments. Gomphosis, that's in your teeth, completely immovable. Okay, we're going to look at the cartilaginous joint, and this is the joint with no joint cavity, like synchondrosis, symphysis. So they just put the cartilage between the 2 bones. And there's another one, synchondrosis, like they put the cartilage there between the first rib and the sternum, and also in your epiphyseal plate. These are the examples. Symphysis are the joints you put in the areas you don't want them to move at all, like the pubic symphysis between 2 big pelvic bones, and between the vertebrate and intervertebral disc, they put the fibral cartilage, the very strong cartilage. Okay, the rest of the lecture, we're going to spend a lot of time talking about the free movable joint. It's called synovial joint. This the joint gives you the maximum flexibility. So as I tell you, you choose flexibility, you give up stability. So this is also the joint we see people got a joint damage all the time, like the shoulder pop out all the time. There's this kind of joint. So let's look at the joint structure. First, to give you the maximum flexibility, they put in the joint cavity. So this is a bone, that's another bone. They separate these 2 bones. This is the joint cavity. So in the joint cavity, they put the liquid to separate these 2, we call the synovial fluid. And to cover it, outside you put those capsules. I call it the duct tape. So those capsules, inside you put those not very strong one called synovial membrane. Synovial membrane's main function is produce synovial fluid, cover it. And outside you put a strong duct tape called the fibrous layer, and together called the articular capsule. These are the duct tape, cover the joint. And this liquid they put inside called synovial fluid. They are mainly produced by the synovial membrane. A function lubricate and also shock absorber. And between joint and joint, between the bone and bone, we call it joint. And in the end of the bone, they put articular cartilage. So these are the basic structures of all synovial joint. And outside they put the ligaments and to cover the joint. So that's the basic joint structure. And sometimes they put other stuff. This is the fancy tools. I call it like the bells and whistles in the cars. So not every synovial joint have this, including the articular disc, also called meniscus. Like in the joint, they designed to be abused. For example, the knee, and they put a pad. This is called the pad, called meniscus. This meniscus is like when you teach your kids to do gymnastics, the coach will say, okay, this is the pad, jump on it, and to decrease the impact. And that's the function of meniscus. They put a very strong cartilage there and to decrease the damage, to take the physical abuse. It's like in this joint, they all have meniscus. If you like to crack your knuckle, and when we talk about the joint, you may think, well, okay, if you crack the knuckle, you lead to arthritis. Is it true or it's true or false? And the answer is it's false. The arthritis come from inflammation happen in the joint, not due to crack the knuckle. So when you crack the knuckle, let's go back to this. Why you can hear the sound? Because when you crack the knuckle, so these are the liquid called synovial fluid. And this liquid, you have air dissolved inside. So when you crack the knuckle, you increase the distance of these two bones. When you increase the distance, the space, the volume increase in the closed chamber. When the volume increase, the pressure decrease. And the pressure decrease, you create the air bubble. And when the air bubble break, you hear the pop noise. So that's how you crack your knuckle. And after the bubble break, it will take them a while to go back into a big bubble. So after you crack your knuckle, you won't be able to crack your knuckle again immediately. So you can crack your knuckle, it won't cause arthritis. Okay, I'll leave this to you. Okay, let's look at the other structures in a joint. Bursa. Bursa are the structure, are the I call it like the bubble wrap. So if you order something from Amazon, they have the bubble wrap. Okay, these are the bursa. So they are connective tissue covered with synovial fluid, and the function is reduce friction. So we found them in the knee, we also found them in the shoulder. And there's another structure very similar to bursa called tendon shields. And it's similar, it's actually the same as bursa, but we wrap them around the tendon. So the same function, decrease friction, so you won't damage the tendon. So you found the tendon shields in the hand, in the leg. So these are the tendon shields, and these are the bursa. The synovial joint are the one give you the maximum flexibility. Depends on the structure and movement, we put them into different category of joints. You need to know the name, you need to know where to find them. So first is called the plane joint. Plane joint, the structure is like two plane. That's how they touch. Where to find them? You find them between the carpal and metacarpal. That's where you find the plane joint. Next one, hinge joint. So hinge joint is like the door. It can only move in one direction. A good example is your elbow. Your elbow is a hinge joint. So your upper limb, you have a hinge joint. Your lower limb, you also have a hinge joint. That's your knee. Next one, pivot joint. Pivot joint is you have a center and you are able to rotate around the center. Like between the radius and ulna. That's the pivot joint. Next one, condyloid joint. Condyloid joint is the surface area, the oval surface area. Because of the contact area, they are able to move in this direction and also be able to move in the other direction. So they have two kind of movement. And where you find them, like the metacarpal and phalanges. So your finger, you can move, you can do the flexion extension, you can also do the AB duct, AD duct. That's the condyloid joint. Next one, saddle joint. Saddle joint, very similar to the condyloid joint. You also can move in two directions. So this joint, you can do the AB duct, AD duct, and flexion extension. But the contact surface is different. The last one called the ball and socket joint. This is the joint give you the maximum flexibility. It's like a ball, you put it there. And when you put the ball in the surface, it has no limitations. So your shoulder joint is the ball and socket joint. When you think about your shoulder, you can move your shoulder almost 360 degrees. There's no limitation. But as I tell you, in a joint, you choose the flexibility, you trade in the stability. So turn out this is the joint, give you the minimum stability. So think about the shoulder. We put tendon, ligaments inside and outside. We start to put the muscles, and we'll put layers of muscles. And you see people's shoulder pop out all the time because this is fundamentally designed to be non-stable in order to give you the maximum flexibility. Now let's look at the movement of the joint. So the first one is called the gliding. This is the gliding movement. You're able to do it at your wrist. Next one called the flexion extension. So this kind of joint start from 180 degrees. So between bone and bone, that's the joint. Start from 180 degrees. When you start to decrease the angle, it's called the flexion. So you can flex your elbow, you can flex your wrist. When you start to increase the angle, it's called extension. So you have flexion, extension. You can flex your elbow, extend your elbow. And if you go over 180 degrees, some joints allow you to do that. We call it hyperextension. Like you can hyperextend your wrist, you can hyperextend your neck. But other joints only allow you to do one, like your knee, only flexion extension. Next one called AB duct, AD duct. I call it the AB duct, AD duct because it's easier to, these two words sounds very similar, so it's easier to distinguish these two. AB duct, AD duct come from the joint, start from 0 degree. Like your shoulder joint, so start from 0 degree. When you start to increase the angle, it's called AB duct. When you decrease the angle, it's called AD duct. And this one is called circumduction, pretty self-explanatory. Next one, rotation. So rotation, you can do the medial rotation, lateral rotation. This one called pronation, spination. So you can pronate your arm, spination your arm. Your feet, you can do the inversion and eversion. And you have the dorsiflexion, plantar flexion. And that's your jaw. You can do the protrusion, retraction. And your shoulder, you can do the depression and elevation. This one is called the opposition. Definition is you touch your thumb to the other finger. That's called opposition. Okay, that's it.